would like now to introduce our honored guest speakers. We have two of them, and they are Dr. Tai Lai Yong and Dr. Wong Hon Seng from Overseas Eye Specialists. And here's how you can find out a little bit more about common eyelid problems in the elderly and common eye diseases among older adults called age-related macular degeneration. Over to you, doctors.
Thank you for your kind introductions. Good evening, everyone. My name is Dr. Tai, consultant ophthalmologist and oculoplastic surgeon. There are several eye problems that are more common as people age, such as presbyopia, cataract, glaucoma, dry eyes, age-related macular degenerations, and droopy eyelids. Today, I'm going to give you an overview of the common eyelid problems in elderly, so that you can recognize early and seek proper treatment. There are a number of changes that occur to the eyelids and surrounding structure as a result of normal aging. Overall, the typical involutional changes of face and eyelids, including descents and deflations of the tissues, loss of volumes and downward movement of the soft tissues and bone, deepening of the skin wrinkles, sun damage to skin resulting in hyperpigmentations and uneven skin. Eyelid protect eyes. Any disease which alters eyelid structure or functions will threaten eyesight. Anatomically, the eyelids has a complex structure. It has an anterior layer of skin, orbicularis oculi muscles, and posterior layer of tarsus and conjunctiva. The eyelids cover and protect the eyes from any kind of trauma, dust, and any other debris. The closure of eyelids help in distributing tear films on the eye surface. The health of your eyelids is essential for the health of your eye. Eyelid disorder in elderly range from infections, inflammations, eyelid tumor, abnormal movement of eyelids, mechanical or structural disorder, facial palsy, and trauma. Recognitions and early diagnosis of these problems are crucial to their proper management. Let's talk about eyelid inflammations or infections. Blepharitis is one of the most common eyelid problems. It is inflammations of the eyelids. Patients typically experience foreign body sensations, sore and itchy eyelids, gritting feeling in the eyes, freaks or crust around the roots of the eyelashes, red eye, red eyelids, sometimes eyelids sticking together in the morning, especially on awakening. It occurs with chronic bacterial infections, meibomian gland disease, seborrheic dermatitis, acne rosacea. The treatment options for blepharitis includes lid hygiene, warm compression to loosen irritating crusts in the eyelids and melts the oil produced by meibomian glands. Then perform lid scrub gently and clean the eyelid with cotton wool or cotton bud. It might help to use small amounts of baby shampoo in water or use the eyelid wipe or antibiotic ointment. Bioflex is a medical device which used to exfoliate the eyelids at the lash line and remove the inflammatory biofilm that lead to chronic lid disease. Meibomitis is another condition of chronic inflammations of the meibomian glands. So when the meibomian glands are blocked, it changes the amounts and compositions of the serums. The patient's eye will feel discomfort, painful, red, swollen, burning sensation, and vision may sometimes blurry. Treatment options include lid hygiene, oral antibiotic, omega-3 essential fatty oil, surgery. Eyelid contact dermatitis is an inflammatory reaction involving eyelids skin. It caused by contact with trigger substance such as allergens or irritants. Skin usually becomes dry, itchy, swollen, inflamed, and irritates. Most common etiologies include eye drops such as anti-glaucoma eye drop, cream, lotions, or cosmetics. Dacryocystitis is an infection of the lacrimal sac secondary to obstructions of the tear duct drainage. It causes pain, redness, and swelling over the inner aspect of the lower eyelids, watery eye, or mucus discharge. In severe cases, it can lead to preseptal cellulitis and even orbital cellulitis. Eyelid tumor. Squamous papilloma is one of the most common benign eyelid lesions. Present in middle or elderly age, may have various presentations. A rough, irregular surface with keratinoid crust formations is common finding. Seborrheic keratitis, also called basal cell papilloma, is another common benign lesion of face, eyelids, or aging individual. The lesions are well circumscribed, waxy, and friable, and can appear like stuck to the skin. Ethnic keratosis, also called solar keratosis, is associated with chronic sun exposure. It is pre-malignant or precancerous tumor. Sun damage of the superficial layer of the skin can progress to squamous cell carcinoma. It usually affects elderly, fair-skinned individuals. Treatment include cryotherapy or curettage and excision biopsy. Xanthelasma is a common, frequently bilateral condition. It's seen in middle-aged and elderly individual. It usually appear multiple yellowish subcutaneous plaque, usually at the middle aspect of the eyelids. It is associated with increased level of serum cholesterol. Treatment include excision biopsy, destructions with carbon dioxide, argon laser. Highest recurrent rate seen in those with persistently high cholesterol level. These are the clinical signs suggestive of eyelid skin cancer, which include ulceration, lack of pain, indurations, irregularity, loss of lid margin architecture or eyelashes, telangiectatic or abnormal blood vessels, pearly borders, a new enlarging pigmented lesion. Adult rarely acquire a nevus or mole, we call that. Therefore, no matter how benign in appearance, all the acquired nevus is in adult beyond the third decade should be biopsy. These are the risk factors of eyelid skin cancer, which include exposure to ultraviolet radiation, type 1 skin, history of frequent or severe sunburn in childhood, a positive family history of skin cancer, patient on immunosuppressive treatment, a history of arsenic poisoning. Basal cell carcinoma is the most common eyelid skin cancer. Most common site is lower lids, followed by middle canthus, upper lids, and lateral canthus. Basal cell carcinoma usually is a locally invasive form of cancer. Metastasis occur very rarely. Worst prognosis seen in middle canthus lesion. Sebaceous cell carcinoma is the second most common, but in Asian countries such as India, China, Japan, it is as prevalent as or even more common than eyelid basal cell carcinoma. It is highly malignant cancer, tumor, capable of aggressive local invasions and metastasis to regional lymph node and also distant organs. Mortality is in 30%. Most common seen in upper eyelid because they have more meibomian glands, usually affect elderly. Invasive squamous cell carcinoma is an invasive tumor arise from squamous cell layer of skin epithelium. Affect mainly elderly, fair skin, more likely to metastasize, perineural spread to orbits and periocular region, as well as intracranial spread in much greater. It may arise de novo or from precancerous lesions such as actinic keratosis, Bowen's disease. It's commonly involved lower eyelid and inner canthus. Cutaneous melanoma is an invasive proliferation of malignant melanocyte, seen rarely in eyelid, and it accounts for about 1% of all the cancer eyelid tumor. These are the treatment options for eyelid skin cancer. So the gold standard is still surgery, total excisions of the tumor with margin control. Other treatment options include radiation, destructive therapy, photodynamic therapy, topical agent, or some of the newer agents like EGFR inhibitor or wismodegib. So another condition, abnormal movement of eyelids. Benign essential blepharospasm is an involuntary condition involving uncontrolled blinking or spasm of both eyes, mostly seen in middle age 40 to 60 years old. The exact cause is unknown, but it can result from progressive degenerations of the central nervous system thought to occur in the basal ganglia. Typically, it affects both eyes, more common seen in women than men. Usually start as a increased blink rate and eventually will lead to closing of the eyelids as well as squeezing of the muscle around the eye, causing temporary inability to see. The spasm disappears during sleep, worse with bright lights, fatigue, and emotional stress. Hemifacial spasm is an involuntary movement of one side of the face caused by compressions of the facial nerve which supply the muscle of the face. The movement may be quick, apparent twitch, may be seen as a sustained spasm involving all the facial muscle on one side. It involves involuntary closure of the eye along with muscle in the cheek, mouth, and neck, but on only one side of the face. It results from vascular compressions of facial nerve where it leaves the brainstem. MRI is recommended to exclude other causes of compressions of the facial nerve. It is associated with mild facial weakness and apparent degeneration. Treatment options include medications, Botox injections, and surgery. Another disorder, mechanical structural disorder of the eyelids, droopy eyelid. Most commonly, patients with droopy eyelid present with a periphery or superior visual field loss, center vision loss in severe cases, tired looking, droopy eyelid, heaviness of the eyelid, brow ache or headache, difficulty in reading. There are three main reasons of droopy eyelid. First, drooping of the eyebrow, we call it brow ptosis. Second is excess skin of the eyelid, we call it dermatocalasis. Third is the actual upper eyelid itself being droopy, which is ptosis. Brow ptosis refers to the sagging of one or both eyebrows. This condition is a natural consequence of aging, and most people over the age of 65 develop some degree of brow ptosis as their facial skin and muscle lose elasticity. Most cases of brow ptosis occur secondary to evolutional changes from the descents and deflations of the periorbital soft tissue of the brow, commonly seen associated with dermatocalasis. Dermatocalasis is an excess accumulation of skin in upper eyelids. Patients usually complain of decrease in vision due to sagging tissue around the eye. It is associated with entropion if severe enough to push eyelashes into the eye, and also herniations of the orbital fat pads due to weakness in the orbital septum. Treatment usually with upper surgery, upper lids blepharoplasty. Ptosis is drooping of the upper eyelid. It is an abnormal low position of the upper eyelid in respect to the globe. The drooping may be mild or very noticeable. In severe cases, the drooping eyelid may cover the entire pupil and interfere with the vision. Dehiscence and insertions or stretching of the levator muscle is the most common cause. Other medical causes of ptosis include stroke, brain tumor, brain aneurysm, nerve damage from uncontrolled diabetes mellitus, infections of the eyelid, trauma of the eyelids. Treatment options for ptosis include conservative and surgery. Conservative management include eyelid crutches, prop contact lens. For surgery, can perform ptosis surgery, which is an operation to tighten the muscle that lift the upper eyelids. These are some of the pre and post-op photo of the droopy eyelids. Another condition, eyelid malformation. Eyelid malposition. Entropion refers to a condition in which the eyelids margin turn inward against the surface of the eye, most commonly seen at lower eyelids. A mild entropion may cause occasionally irritations and dry eye, while a severe entropion may cause corneal erosion and maybe sight threatening. The most common cause of lower eyelid entropion is an age-related instability of the eyelid structure, such as dehiscence of the lower eyelid retractors and horizontal eyelid laxity, which is more commonly seen in older patients. What is the treatment for entropion, which can be non-surgical or surgical? Non-surgical treatments is temporarily, which include artificial tears or lubricating eye drop, using eye tape, contact lens, or Botox injections, which can actually help relieve the symptom of entropion. But usually, eyelid surgery is needed to fully correct the condition by turning the eyelid margin and eyelashes away from the eye. These are the pre and post-op photo of entropion. Entropion is a condition where your eyelid margin turn outwards or away from your eye, exposing the inner surface of the eyelids. This condition can cause eye dryness, excessive tearings, and also irritations. Entropion may be due to several causes such as facial nerve paralysis and injury, but the most common cause is muscle weakness or muscles sleeping due to aging. Eyelashes misdirection. Trichisis is an acquired eyelid abnormality in which there is a misdirection growth of the eyelashes with a normal lid margin position. This trichisis is an abnormal growth of lashes from the orifice of the maple wing glands on the posterior lamella of the tarsal plate, causing an aberrant second row of lashes. Patients usually complain of foreign body sensation, redness, lacrimation, pain, photosensitive, and constant rubbing of the eye. Treatment option includes mechanical ablation with forceps, radiofrequency abrasions of the lashes, electrolysis, cryotherapy, laser abrasions, trephinations, and surgery. Facial nerve palsy. Patients with facial nerve palsy usually present with paralytic entropion and lack of thymosis, unable to close their eye completely. These are the treatment options for facial nerve palsy, which include temporary and permanent treatment. Temporary treatment include lubrication, Botox injection, temporary tarsorrhapy in patients with poor bowel. A permanent treatment involves surgery. Usually will delay the surgery at least 6 months to observe any recovery. Thank you. This is all for my presentation today. The next speaker will be Dr. Wong Hon Seng.
Hi, good evening, everyone. First and foremost, I'd like to introduce myself. I'm Dr. Wong Hon Seng. I'm the consultant ophthalmologist at Overseas Eye Specialists, and I specialize in the disease of medical retina and uveitis. So I would like to say a big thank you to amazing seniors for organizing this talk. And today I'm tasked to talk about age-related macular degeneration. So first and foremost, I would like to bring us all back to the basic, all right? I would like to introduce what actually is the organ of the eye does. All right, inside our eye, light is focused by the cornea and also focused by our normal crystalline lens, and it's focused onto the retina. And the cells in the retina we call photoreceptor will detect the light and will convert the light into a signals that will be sent to our brain and it will be interpreted as vision. And these signals are transmitted to the brain through our optic nerve, and that's what leads to us being able to see. So if we have a closer look into our eye, when the doctors look inside a person's eyes, this is actually what we see. All right, and this red circle is a circle whereby we call the macula, all right, which is the dark spot at the center of the retina we call the fovea. And at this particular area, it has a high concentration of photoreceptors. And this photoreceptor or these cells is responsible for our central color vision. So what is age-related macular degeneration? Or we call it AMD. AMD is actually a very common eye condition and is one of the leading cause of visual loss for people that is older than 50. Why is it that it causes visual loss? Is because it damaged the macula, which is the central part of our retina. It actually is interfere with our vision. Macula is the area inside central vision, and it let us see objects that are straight ahead of us. So I purposely bring up this photo to highlight to you what is the difference between a healthy macula versus a macula with AMD. So as you can see at this diagram, on the left-hand side, this is a healthy retina. You can see the optic nerve, you can see all the blood vessels, and you can see the macular region. All right. there is no abnormalities. As opposed to this particular picture here over the right, you can see that at the macular area, you have all these fibrovascular scar due to AMD. So what are the prevalence of AMD in people over 50s? Well, the proportion of people with AMD is over 50 is around 11%. And out of that, 2% they are diagnosed as wet AMD, and then 9% are diagnosed as dry AMD. So what is the difference between a wet AMD and a dry AMD? The wet type of AMD is the more rare type, however, it's also more serious. Why is it it's called wet? Is because there are abnormal blood vessels that have grown beneath the macula, beneath the retina. We call those the choroidal neovascularization. So these abnormal vessels, because it is abnormal in nature, so it's very friable, so it will easily break. And because of that, it will leak out blood and it will leak out fluid. And due to the bleeding and also due to the fluid accumulation, it will damage the cell in the macula, and that will lead to visual loss. So as you can see from this color photo of the patients with wet AMD, you can see that at the macular region here, you can see that there are red color discoloration. So all these are blood. So these are blood. So they are bleeding from abnormal vessels. Then at the same time, you also can see there are some yellowish deposits. So these are all the exudates. So the blood vessels, besides leaking out blood, it also leak out fluid, it also leak out lipid material, and that gives rise to this kind of changes. How about dry type of AMD? Now, dry type of AMD is much more common. It will occur when the retina gets thin and dry out. And when we have a look at the retina, we will be able to appreciate there are multiple small yellow deposits we call drusen that's formed beneath the macula. So basically, all these small yellowish deposits, they are deposits of waste product of our cell. Because when the cells inside our retina starts to degenerate, it is unable to function normally to get rid of the waste product, and thus those waste products will accumulate inside the retina and subsequently form drusen. And when the drusen become more increased in size, it will cause damage to the cell around it and leads to visual loss. So as opposed to the previous slide, this picture shows that there are multiple drusen at the area of the macula. However, you don't see any blood or fluid accumulated at this area. So actually, if we look at dry macular degeneration, there are three stages of dry AMD. You have the early stage whereby you just have a small drusen. However, the patients actually do not have any symptom, and they can still see very well. You also have the intermediate stage whereby the drusen size become bigger, and the patients will start to complain that they may see a blur spot at the center of their vision. And in the advanced stage, whereby there is a breakdown of the light-sensitive cell and also the supporting tissue in the central retina area, a patient with an advanced stage of dry AMD, they will complain of central visual loss. So what are the risk factors for AMD? First and foremost, as the name implies, it's age-related. So age is definitely one of the major risk factors. So as one grows older, the older ones live, the higher the risk one will have AMD. Besides that, if you have AMD in one eye, then the chances of you having AMD in the other eye will be higher. Certain diseases like hypertension, cardiovascular disease, or high cholesterol level, all these are associated with higher risk of AMD. A person that have abdominal obesity, or a person that have always been exposed to high level of sunlight, they are also at higher risk of AMD. Other than that, smoking, a person that smokes, definitely will increase his or her risk of AMD. Then Caucasian race and also female gender have a relatively higher risk of developing AMD. So how does AMD affect one's lifestyle? All right, and whether your lifestyle can make a difference. So after analyzing all those risk factors in the previous slide, one might be able to reduce your risk of AMD or slow down its progression by making these healthy choices. First and foremost, avoid smoking. Secondly, exercise regularly. Maintain a normal blood pressure and cholesterol level. And eat a healthy diet rich in green leafy vegetables and also diet that is rich with fish. So if a person have AMD, how does it affect one's vision? So patients with AMD, they will complain of a loss of the ability to see objects clearly. They may complain that seeing straight lines appear to be wavy or distorted, or they may notice that there is a disturbance of the color of object that they see, or they may appreciate a dark area of gray or white spots that may appear in the center of the vision, as shown by this picture over the right hand side, whereby a person with AMD, they will notice that centrally the vision is blurry and distorted. So this particular slide highlights the progression, all right, of a wet AMD. So from normal, then they will start to see some distortion, and ultimately centrally it will be blurred. Then eventually it will become a gray or a dark spot centrally. So this is how it affects our vision. So how do we diagnose? How do we know a person have AMD? First and foremost, we can do an eye examination by checking their visual acuity. Then subsequently, a doctors need to examine your eye by doing a dilated eye examination. So we do eye examination using slit lamp or using a ophthalmoscope, or we can do it by doing certain scans to for example, OCT scan to scan your retina. Another easy way that actually all of us can monitor at home is that we can use the Amsler grid to monitor. So basically, how you do it is that you cover one eye, the unoccluded eye, you look at the chart, centrally look at the black spot, and you should not see something like this right side chart, whereby you see a distortion of the images, or centrally there is a black spot. So this is a very easy way for one to detect whether there's any changes in their macula. When you see a doctor, an eye doctor, the eye doctor may suggest that you need to undergo a fluorescein angiogram. So basically, fluorescein angiogram is in a way just like angiogram of our heart, all right? Whereby the doctors will inject a medicine we call fluorescein dye into your blood vessels. Then this dye will travel to our eye, and we will use an imaging system to capture the images. So through this test, this fluorescein angiogram, it will be able to highlight, all right, whether there's presence of abnormal vessels inside our eye. And that will help us to clinch the diagnosis of wet AMD. Other than that, we have a non-invasive imaging test we call OCT, or optical coherence tomography. So OCT, basically this machine, they use light wave to take a cross-section picture of our retina. So by doing this non-invasive imaging, we are able to actually appreciate the layer of the retina inside our eye, and that will be able to help us to diagnose and manage cases with wet AMD or with AMD. So how do we treat a person with AMD? If you have that type of AMD, then the gold standard of treatment is actually by giving intravitreal injection of a medicine we call antivascular endothelial growth factor, or anti-VEGF. So by injecting this medicine directly, all right, into the eyeball through the sclera here, so the medicines will help to regress those abnormal vessels and will also help to resolve the blood and the fluid accumulated in the retina. And that will lead to improvement of vision. So this is just a video that I want to show you all how I do an injection of anti-VEGF into a patient's eye with wet AMD. So as you can see, this procedure is done under a sterile condition. So the patient is clean, the patient's eye, all right, eyelid are clean with povidone with antiseptic solution. After thorough cleaning, all right, a speculum will be put to open the patient's eye. Then after that, all right, the patient is asked to look down. Then we do a marking over the eye of the patient. Then after that, through a very small gauge needle, the medicine is injected into the patient's eyeball. Besides giving intravitreal anti-VEGF, there are other treatment options as well for treatment of wet AMD. There is a therapy we call PDT or photodynamic therapy, whereby the patients will receive an infusion of medicine we call Wisudine. So this medicine will be injected into our vein, into the patient's vein, and the dosage of the medicines is determined according to the patient's height and weight. Then the laser, all right, will be given 5 minutes after the infusions end, and this laser, all right, will activate the medicine, the Wisudine medicine, and that will regress those abnormal vessels inside our eye. Besides that, okay, before the age of anti-VEGF, all right, people do give laser or surgery have been performed. However, pure laser and surgery, retina surgery in treatment of wet AMD did not shows any great result. And thus nowadays, rarely people do these two types of treatment. So that is my last slide. So I would like to thank you, all of you, for listening to my talk. Thank you very much.
Thank you, Dr. Wong, and earlier, thank you, Dr. Tai, as well. We have quite a few questions, so I'll just get right into it. Doctors, if you are already ready to take on the questions. Dr. Tai or Dr. Wong?
Okay. Can you hear me?
Yes, we can.
Hello.
Yes.
Hi, Raj. I'm Dr. Wong Hon-Sing here.
Hi.
Nice to meet all of you.
Thank you. Thank you so much, Dr. Wong. Pleasure meeting you as well. And thank you for taking the time for this today. Now, I've got a bunch of questions. If you're okay, I'll just get into them right now.
Sure.
Yep. I've got one question here from one of our participants, Lien, and they ask, what causes eyelid infection or inflammation?
Well, okay, generally, eyelid infection, if you're talking about chalazion, whereby it's because the glands over the eyelid is obstructed. And because of that, then whatever secretion inside the gland starts to accumulate and then get secondary infection. And that is when you have an infection. In a way, it's just like a pimples that have grown over your eyelid. So of course, it is got to do with personal hygiene. All right, because sometimes if let's say if our hands are dirty and we rub our eyelid and things like that, that can cause infection. And for ladies, sometimes it is associated to the fact that because eye makeup was not removed properly, and that actually can cause infection over the eyelid as well. And as for children, all right, most of the time is because of their excessive rubbing of their eye.
Okay, great. Well, I'm guilty of rubbing my eyes a little bit excessively as well, so I'm a little bit concerned. Okay, another question that we have is from Betty Pua, and she asks if eye tumors or cancer spread to other organs. Is there a risk of eye tumors spreading to other organs in the body?
The short answer to that is yes. All right, is because any cancer cell, all right, it can spread either through the lymphatic drainage, all right, to other part of the lymphatic system. And sometimes if the tumor cell has invade into the blood vessels, then through the blood flow, cancer cells can travel to other organ. So the short answer to that is that yes, cancer and tumor can spread. And not only it can spread, sometimes some aggressive cancer, it can directly invade to the structures around the eyelid.
Thank you for that, doctor.
And I would like to add as well, some skin cancer, the common ones, basal cell carcinoma, actually is more or less invasive, whereas for squamous cell carcinoma, they can actually spread to the brain through the nerve itself also. That's more dangerous. If you have that form, you really have to be careful. And they even can spread to the lymph node, the liver. Yeah. So once we diagnose, we will just do this whole body screening already for this patient.
Okay, thank you. Thank you for that as well, Dr. Tai and Dr.
Oh,
Wong.
Hey, hi, sorry, I'm late in because I can't unmute it.
Yeah.
Okay, and one question we have by one of our participants, C, who is asking, is blepharospasm and hemifacial spasm hereditary? Is there any way to prevent the development of such spasms? Spasms, not spam.
Okay, thanks, Raj. Actually, for blepharospasm and hemifacial spasm, the exact cause is unknown, but genetic factors actually can consider, but there's a few trigger factors for those spasm, which includes excessive consumptions of alcohol, caffeine, smoking, lack of sleep, stress, and also eyelid irritations. All these can trigger the spasm. So the way of prevent it is actually to rest early and then got enough sleep, and then don't stress too much, and also reduce their alcohol consumptions and caffeine consumptions. And if they have eye irritation problem, have to seek for treatment. Then it will help them to have at least will relieve them from spasm that occur frequently.
Okay, great. I hope that answers your question, C. Another question that we have is from Nazneen. Basically, sort of like a two-parter question here. She says, Doctor, sometimes I can see floaters in front of my eyes for a while, but then they disappear. Can you let us know what is the reason for this? And as an extension of that, what is your recommendation in terms of going for an eye checkup? Is it like every 6 months, the same way you would go and have a dental checkup, or less frequent or more frequent?
Okay, let me answer that. Basically, floaters, there's a lot of probability why a person see floaters. Generally, the most common cause is because the vitreous gel, all right, that contain inside our eyeball, when it starts to degenerate, all right, it will shrink. And because of that, all right, sometimes we'll see floaters, all right. And this kind of floaters, generally, they are benign. They can be very annoying because you will notice the floaters floating in front of you, especially if, let's say, you're under the sun, or let's say the background is very bright. For example, you're looking at a computer screen, then the floaters will become more obvious. But otherwise, it does not cause any big issue. For example, it will not lead you to have progressive blurry vision or leads to blindness. All right, and that is generally is the most common cause. I would advise my patients to look out for 3 particular symptoms. If you see floaters, it is annoying, but if you're seeing that all this while there are 2 or 3 floaters, it is not of a big concern. However, if let's say tomorrow morning when you wake up, you notice that I'm seeing more than 20. So with this sudden increase of number of floaters, that is a big no-no. So that is a red flag. Then you should immediately go and see an eye doctor. Or if you're seeing a floaters, then at the same time, if you notice that you're seeing flashes of light, for example, it's like a flashlight from a camera, or sometimes some patients will complain that it looks like a comet, like a line of light. So if you're seeing this kind of symptom at the same time with the floaters, then yes, you should immediately consult your eye doctor. And the third symptom is if you notice that your vision is getting more and more fuzzy. For example, you notice that it's like a little bit cloudy, like you're in Genting, all right? That is also something that is not normal. Because as I started, answering this question earlier, floaters can be caused by a lot of things. It can be because of bleeding inside the eye also can cause floaters. Inflammation inside the eye also can cause floaters. So these other causes are more severe and should be treated as soon as possible.
Okay.
As to the second part, I think someone asked, how should we follow up? I mean, whether you need a regular eye checkup.
How frequent should the visits be? Yes.
Yeah. So generally, if let's say if you are young, you are healthy, I felt that personally, you don't really need a regular eye checkup. However, for example, let's say if your siblings or your parents have eye disease, like they have glaucoma, then I think you should have a regular checkup if your age is more than 40. If your parents have age-related macular degeneration, all right, then I think you should have an eye checkup annually if you're above 50. If you have underlying diabetes, hypertension, or high cholesterol, I think you should have an annual eye checkup. I mean, is there anything you'd like to add, Lion?
The other thing is like for the floaters, right? If you recently have a trauma, or any accident to the part of the eye, then you experience floaters. That one also, I think you need an eye checkup. Yeah, to make sure your retina is all right.
Yep.
Great. Thank you, doctors, for that very elaborate answer. We have time for just one last question, and this is from YWC, who asks, if a 70-plus-year-old woman is physically active and eats healthy food, what could have caused her eyes to become so bad that she needs to undergo one cornea transplant after another?
Okay. Okay. Most likely, in my opinion, all right, if let's say if she is healthy, her eye never have undergo any surgery, and the cornea basically is decompensating, it's not functioning as normal, so that's why she ended up needing a cornea transplant, then most likely she must have some underlying cornea problem, all right? Condition like corneal dystrophy and things like that, which may not manifest when she is of a younger age group, all right? But however, when ones grow older, so those cells to begin with is not that healthy, but with age, it will deteriorate further. So that's why she ended up needing a cornea transplant and things like that. I mean, that is my opinion, most likely what have happened to her.
Or is she experienced like eye redness before she need to go for cornea transplant? Maybe eye infections or eye trauma that she have it. That should be the reason why the cornea decompensate or is not healthy, that she need a cornea transplant.
Okay, great. Dr. Wong, Dr. Tai, that's it. That's all the time we have for as far as the questions are concerned. I would like to just take this opportunity to thank the both of you once again for your time today and sharing an insightful talk with us. Thank you. Thank you once again.
You're most welcome, Raj.
Thanks for having me.
Yeah, and thanks for helping us end the second day on a big bang. I think this has been a very interesting topic as well. So we thank you very much for that.